Well, good morning. Thank you for joining us this morning. My name is Eric Deaton. I'm the Chief Operating Officer for Ballad Health. Before we start comments, I did just want to say thank you to all of our team members across Ballad Health for all the very hard work that they're doing right now. It's under a fair amount of stress that they're working under, and I just want to say thank you so much for all the great things that they're doing and the compassion they're showing to our community and to our patients every day. It's not going unrecognized and very appreciated. First of all, let me give you an update on rapid testing. We announced yesterday that we are among one of the first healthcare organizations in the country to deploy rapid testing for the COVID-19 virus. What took 4 to 5 days to 7 days sometimes to get testing results back is now will take just a few hours. A matter of 4 to 7 hours now we think we can get tests back on COVID-19 patients. So this is very good for us because it really does change the way that we're addressing COVID-19. We'll be able to immediately test up to 50 patients a day with our new capacity. We're actually acquiring additional equipment to add up to over 400 tests a day in the coming weeks. This is really important for a couple of reasons. One is it allows us, by quicker testing of patients, when a patient is found to be negative, we can not have to utilize the PPE equipment that we use every day that's so precious to us. The second thing is that we're now allowed to, by testing patients earlier, we can isolate them quicker from the rest of the population and help stop the spread of the coronavirus to our community. So this is really game-changing for us. We're excited about this opportunity. I want to thank the lab team that worked on this for all their great work to bring this to fruition. We're excited that we can do that now, and we will continue to expand that as we have the capability to do so. Secondly, I want to tell you about virtual health. There'll be more coming about this in the coming days. Earlier this month, we have expanded our telehealth program, which will allow our patients to have access to their provider without the need of having to travel. In the next few days, we'll be announcing the expansion of virtual health that will allow over 200 providers to interact with their patients on a virtual basis. We'll also be providing to the public how they can better access this level of care and give you information on how to do that electronically. So be on the lookout for that. Next, PPE, or personal protective equipment, we've talked a lot about. Just to give you some information about that that's pretty exciting, is that we are now able to reuse and sterilize N95 masks, and Ballad Health has the capability of doing that because of the equipment that we have in many of our facilities today. It currently allows us to actually recycle those masks twice, which would actually be tripling the life of these very precious masks that we have. So we're in the process of implementing this sterilization process. We'll be standing it up by the first of next week, and we're also partnering with ETSU and other providers across the region to help the health departments also do real re-sterilization of their masks as well. It will actually extend the life of the masks, as I mentioned earlier. This is a really innovative approach, and Ballad Health is one of the first and few organizations across the country actually implementing this re-sterilization of N95 masks. Speaking of masks, I want to say thank you to all of our community who has been so generous in making masks and providing those to us. It's been amazing. We've received over 250 masks that people have made across the region, and we are extremely grateful for that and all the support that we're getting. There's information on our website if you want to make masks and help us with this. There's information on our website on how to do that. The parameters on which we need to have in order to make sure that those masks are appropriate use for us. So if you go to our website, and if you want to make masks, understand the best way to do that. Again, thank you to our community for doing that. Population health call to action. This is obviously an emergency that we're all facing together. We're all working on together. One important role for people who are in the healthcare arena with a public health background or with a medical background is to possibly join the Medical Reserve Corps volunteers. We would ask you, if you are someone that has those abilities, to look at possibly joining that group. You can do it in two ways. For Northeast Tennessee, you go to www.tn.gov, and in the search bar, you'll put the volunteer mobilizer there, and actually look for ways that you can volunteer as a medical professional. And then for Southwest Virginia, it's www.vdh.virginia.gov/MRC/. And again, if you would go online there and volunteer, we could certainly use your help across the region in a variety of ways. This is a great opportunity for healthcare professionals, graduates of health sciences, who can really make a difference across our community. Ballot Health has already been partnering with a long list of our regional colleges and universities to really help spread the word, and so we'd like the public to also be aware of this and look for opportunities for us to volunteer and to work with us as we try and combat COVID-19. Last but not least, I want to say thank you to our regional health departments. These amazing folks are working tirelessly, working very hard every day to manage this crisis. We're working hand in hand with them. I personally have calls almost daily with our local health departments as we work through this, and they have been fantastic and amazing to work with. I'm so grateful for our partnership during this crisis. They are headed by very capable administrators and physicians who are really doing a great job for our region every single day. And I just want to say thank you for that and all the hard work that you're providing to our communities. Now let me introduce Jamie Swift, our Assistant Director of Infection Prevention, to give you an update. Jamie.
Thanks, Eric, and again, thanks to our media partners for being here. So I want to start with an update on our numbers. Currently, as you may have seen, there's 77 cases in our region. It's really important to point out that the day prior there were 59 cases. So in 24 hours, that was an additional 18 cases in our community. That's been our biggest jump in a 24-hour period since we started our response. I am sharing that since Tuesday, we have had an additional death. So this was a resident of Sullivan County who was in the age range of 51 to 60. Obviously, as we see our numbers go up, as we see them go up very rapidly, I think we are entering that phase that social distancing is becoming more and more important. We are pleading with our community to please social distance, stay at home, help us protect our community, help us be able to respond as healthcare workers, and have that curve flattened so that we can have a response for all of our community. I did want to give an update on the Hawkins County cases. So as you know, on Tuesday, we did announce that there were 3 team members at Hawkins County who had tested positive for COVID-19. This morning, we're reporting there is 1 additional team member, so that's a total of 4. All 4 of those did work in direct patient care. It's important to remember that since the pandemic started, we've really tried to protect our community and our team members with various measures. So we feel like the restricted visitation, our team members wearing masks, are really important right now. There's been a lot of questions on how we're notifying people, and so because of the various opportunities that you may have been exposed if you were in the Hawkins County Memorial Hospital, we're asking that if you were in that hospital between March 20th and March 31st to be vigilant for monitoring of symptoms. Certainly call the Nurse Connect line if you develop symptoms. We're also asking that you really practice the social distancing. And typically, I think you all know, when we're doing contact tracing, it's usually we call each individual. And so because there were multiple team members within a confined facility, we chose to go the route of the press release to let everyone know, because it almost would have been impossible to catch every single contact with the various exposures. So that's why we announced it the way we did. We'll continue to do contact tracing on our cases. We'll continue to notify appropriately, whether that's individual phone calls or with future media releases. That's really all the updates I have right now, so I will turn it over to Alan Levine.
Thank you, Jamie. Good morning, and first of all, let me just say to the family and to the team members who were involved in caring for the gentleman who passed away, our condolences and our prayers are with them. This individual really, again, the results, we're not seeing anything different than what we were told to expect. And so we're continuing to watch each case that comes into the hospital to make sure that we're monitoring those closely. And in fact, we've had some cases from members of our own work family who've been affected and who are in the hospital. And so this is obviously something that affects everybody, both in the work family and at home. So our prayers are with them, and we'll leave it to the family and that individual's work family to communicate further about that individual case. Eric mentioned the rapid testing. You know, we've tested about 1,000 people. Ballot Health has tested about 1,000 people since March, I think, 17. And you know, very few number of positives that we've seen, roughly 30, 35 in that range, I want to say. And so because of the rapid testing that we've gotten, we believe that by prioritizing those cases as inpatients, patients who are severe that are in our emergency department, presenting in our emergency department, in our team members, that we will have the capacity we need to deal with the most severe cases over the course of the next week or so until we get the new analyzer that Eric was talking about, which will give us capacity for up to 400 cases per day, 400 tests per day. We're glad that Ballot is one of the first health systems to have that capacity. I do anticipate that over the course of the next few weeks, there's going to be a lot of innovation coming to the marketplace that may even get us past some of the ways we're doing testing now. And we're certainly looking forward to that, because I think, as we've articulated, one of the biggest opportunities for improving the overall response nationally is to improve the rapid nature of the testing. We've got to get to where we can get test results quickly. This most important thing we can do to protect our team members and to reduce the use of PPE. Eric mentioned virtual medicine briefly, or maybe he didn't.
I did.
He did, okay. You know, we will have within the next few days up to 200 of our providers that are available and accessible via telemedicine. We've long used telemedicine technology. Every one of our emergency departments is connected to Niswonger for telemedicine capacity for our pediatric patients. We're in almost 100 schools now using telemedicine. So the use of this technology is not new to us. We're glad to see some of the other physician groups able to start doing it because of some of the changes that have been made at the federal level that permitted them to start using that technology. We will have it up and running for almost 200 of our physicians. Actually, it's already up and running for 80 being tested. Within the next few days, we'll be able to announce where to go to access your physician using telemedicine capability. And we think there's obviously a need for that, given the big decrease in use rates that we've seen people visiting their doctors. We want to make sure people have access to their doctor when they need it. Eric did mention the Medical Reserve Corps volunteers. Look, that's one part of trying to prepare for a potential surge. So as I mentioned Tuesday, you know, while we're dealing with what's in front of us, we're also trying to plan for what we see is what we think will hit our capacity within the next 40 to 60 days, 40 to 70 days. And so a lot of the work that we're doing now is to try to prepare for that potential. And so by asking people to volunteer for the Medical Reserve Corps, it's possible we may need to call on additional help, just as Vanderbilt has been doing for the last few days. So these are steps we're taking now to prepare for what may come later. And so we ask for people to consider that. As we've mentioned, we have a few hospitals that we are standing up for the purpose of use for COVID-19. One of them is Lonesome Pine up in Wise County. The other one, as you've heard, is Tacoma or Greenville Community Hospital West in Greenville. We're in the process right now of making some changes with some of the services that we're providing at Tacoma. Within the next 24 hours, that hospital will be completely emptied out of other services so that we can be prepared to use it in the event we need to use it for surge capacity. So now we have two specifically designated facilities where we are taking action to clear the decks, if you will, to make sure that that facility or those two facilities can be used for additional capacity. The use of Tacoma the official really designated use of Tacoma came after an earlier visit this week with the Army Corps of Engineers. Our team, led by Eric, I was there and others were there to meet with the Corps of Engineers and the folks at ETSU to look at various areas of potential capacity. And we're grateful for the work that the state is doing in deploying the Army Corps of Engineers. We're grateful to the governor for deploying them here. And we're continuing to have dialogue with the Corps of Engineers as we continue to look at our capacity opportunities for in the eventual case that we do get a surge. Eric mentioned the re-sterilization. I'm really pleased that we're able to provide our resources to community-based physician groups. You know, we have the capacity, I believe, of re-sterilizing up to 5,000 of these N95 masks each day. So by virtue of being able to do that, not only can we generally triple the use of our masks, we can actually provide that capacity to physician groups and other organizations in the region, and we're glad to be able to do that. That's something that Ballad Health is certainly pleased to be able to do for our partners and colleagues in the medical community that are not directly affiliated with Ballad Health. I want to reiterate the issues of mental health. I can't overstate this. I'm glad the governor made it an issue yesterday during his briefing. We talked about this on Tuesday. We're going to keep talking about this. I believe there's going to be an emerging mental health problem. And what you've seen through Ballad Health social media, we've been promoting places you can go and call. And again, I will repeat, and I would ask the media to keep repeating this, seeking help is a strength, it's not a weakness. And we're going to keep talking about that, because the most important person to protect you and your mental health needs is you. You're the one who recognizes, or has to recognize, when the stress is getting to be a little bit much. And you need to be able to seek help from people who can help you cope. Coping is something we all have to do with issues that occur in our lives all the time. Right now, we're dealing with a host of issues that are a combination of financial issues as the impact of this affects you. It's coping with the concern about your family's health, concern about people you know who've been affected by this, or who may be affected by it, fear of the unknown, fear of misinformation. All these things lead to the need for coping, and we all have our limits, and it's okay to seek help when you feel you're getting to your limit. I want to talk a little bit about the financial issues that we're facing. It's no secret, we've been talking about this for a few weeks. Hospitals all over the country, you're starting to see a cascade of decisions that are being made all over the United States by every health system, from for-profit all the way to the largest Catholic health systems in the United States. 2 of the 3 largest Catholic health systems this week announced pretty major furloughs for their systems. We're seeing it Erlanger in Chattanooga, Appalachian Regional Health up in Kentucky, other Cape Fear, other systems are starting to move very rapidly towards making decisions designed for 2 reasons. Number one, because there is a major cash flow impact of all this, of the deferral of all these elective procedures, the 70 to, in some cases, 90% reductions in volumes that healthcare providers and hospitals are seeing. That has an enormous impact on the cash flow of any health system, of private physician groups. Everyone's being impacted by this. And people's jobs are being affected by it, there's no doubt about it. So, we are evaluating what Ballad Health's options are. I do think that hopefully by Tuesday we'll be in a position to talk more, I think more specifically about steps that we will take or will need to take. Our first priority is the safety of our team members. And to be clear, I mentioned that one of the reasons for hospitals furloughing staff is financial, but the other reason is it's a safety issue. Right now, particularly as the virus continues to spread and as it starts affecting team members, the best thing we can do for team members, if they don't need to be in a hospital or in a work setting, the best thing for them is to be in a safe setting at home and not coming into the hospital. The fewer people in the hospital that don't need to be there, the better. So the issue of the potential for furloughing team members is not just a financial issue, it's also, more importantly, a safety issue for team members who don't need to be in the hospital, while certainly you're at a 70 to 90% decrease in volumes. So those are the types of things that are informing the decisions that have to be made. They're difficult decisions, and I don't think that they're any surprise to people. I think that everybody understands what happens. A system like ours has seen about $100 million per 30 days decrease in our revenue. That has an impact, and you know, the concerns that we have in a region like ours where you have no population growth and decreasing use rates even before all this happened, there becomes a concern about when you lose that kind of cash, whether or not you can actually get it restored after the event occurs. And so these are the concerns of rural and non-urban hospitals and health systems all over the United States right now. It's the central point of conversations we're having with members of Congress and folks in Washington, so people can understand sort of the unique effect that this is having on rural and non-urban health systems. I want to end this on a bright note. There's a young boy named Maddox Curley who lives here in the region. I think he must be 3 or 4 years old. The cutest little kid. Yesterday, a random person messaged me and told me about this video that this little boy had made. And this little boy, it is an amazing video that we asked for permission from the father. The father's name is Grant Curley. We asked for Grant's permission to share this video, and so within minutes we'll be putting this video out on social media. It's the words of a little boy who himself is a hero, but because he's locked up at home as a little superhero, he can't himself go save the world. And so, because he himself can't save the world at the moment, he's delegated all of our doctors and nurses to do it on his behalf. And it's the most adorable video, but it sends the best possible message we can send to our frontline team members who are coming in every day facing the unknown and putting other people's needs ahead of their own. And so I'm just grateful to Grant and ever so grateful to little Maddox for producing this video, and we're proud to be able to share it with the public, and that'll be on social media here shortly. So with that, I'll answer any questions anybody has, or we'll have the team try to answer them.
All right, we'll open up the line. We have Blake Lipton with WJHL. Blake, do you have a question?
Hey, Alan, we're hearing from some folks that there was a Greenville doctor with Valley Health that tested positive for COVID-19. Can you confirm this? And if so, can you tell us his name? And how did you guys find out about it?
Well, I will, and the reason I will, Blake, the question is about a doctor in Greenville that's been is he still talking?
Yeah, it's Blake, after you asked your question, would you mind to mute your line so you won't have the feed come through?
I apologize. I thought he was
okay.
still asking the question. Blake, I will, it would be unusual for me to do this, but I will now because he's been on social media talking about his experience. His name is Dr. Daniel Lewis. He's a wonderful man. He's a phenomenal doctor. He's our chief medical officer in our Greenville market. Yes, he's been admitted to the hospital. He's been diagnosed positive with COVID-19. Something he said, he and his wife have been asking for prayers. I communicated directly with Dr. Lewis last night. His response warmed my heart. He said, as a physician who knows better than anybody the quality of care at Ballad Health, he wouldn't want to be in any other hospital but a Ballad Health hospital right now. We are praying for Daniel. He is a wonderful man. He's an asset to the Greenville community, and the entire Ballad Health family is praying for him.
Blake, do you have an additional question?
Yeah, what was kind of the extent of his exposure to other patients in that too? And are there any precautions that those people have come in contact with him should they take?
I can't answer that. I don't have firsthand knowledge of that, Blake. I think, let me say generally speaking, one of the weaknesses early on with this whole thing with the testing is the delay in getting, the delay in results when you test somebody and you don't get results for 5 to 7 days. Now, when we do test somebody who's symptomatic, we try to isolate those patients, or we send them home and tell them to stay in isolation. But in certain circumstances, there may have been contact, and that contact can possibly cause a spread. And so I'm speculating here about how this could have happened, but this is why we have been so aggressive about trying to get the rapid testing here. I'm going to let Jamie step in because she might have a little bit more information about this. Jamie, why don't you?
Hey, so we can give you a few details. We do know there was a confirmed contact that he was in contact with. We worked very closely with our Tennessee Department of Health on the investigation. There was not a lot of notification that had to happen. There was no exposure to patients in the Greenville Hospital, so we made sure of that. And then within his practice, there was no notification that was necessary because of PPE that had been worn. So mask wearing and things like that had really limited the exposure and the contacts that needed to be notified.
Yeah, thanks, Jamie. That's important information. I think as we get now with the rapid testing, when we have a potential exposure, we have the ability to move quicker to get the testing and then get the result, which will help a lot. And again, that's why we're prioritizing team members, inpatients in the hospital, or patients who present with symptoms in the ER. That's why they're being prioritized, and we think that'll help mitigate any potential risk of exposure.
Thank you, Blake. Now we have Scott Robertson with the Business Journal. Scott, do you have any questions?
I do, thank you. Alan, you mentioned that you'll perhaps talk next Tuesday about measures regarding staffing, for employee safety. But in addition to cutting costs that way, there are other austerity measures that I'm assuming Ballot Health is taking at this point. Can you talk about the kinds of goods and services that Ballot Health is cutting back or eliminating spending on as you deal with the economic effects of this crisis?
Yeah, so right now, and again, it's uncomfortable to talk about finances in the middle of a clinical emergency, but the two are linked. You know, a health system that doesn't have a strong cash position is not in a position generally to care for its community in a reliable way, and that's why, you know, being very hyper-focused on preserving our cash is really important right now. So yeah, there are steps that are going to be taken, and some that already have been taken. We have ceased all capital spending with the exception of our IT conversion and the completion of the emergency the EMS access to Johnson City Medical Center that was under construction. Outside of that, we've ceased virtually all of our capital spending for right now. A lot of the spending related to the Certificate of Public Advantage has been suspended with the permission of the state of Tennessee. And you know, those are things that, again, we're trying to do right now to refocus our energy, our effort, and our resources on the response for the COVID-19. There may be some other steps that are taken. I think the best way to explain it is the process we're using. It's almost a three-phase process. The first phase is what do we need to do immediately to mitigate some of the negative cash implications of this. The second phase is once we have a much more clear understanding of what the federal stimulus bill will do for us, once we understand that, then we can have a little bit more clarity on additional steps that either may need to be taken or not, depending on what the federal government's going to do. There's still a lot of information we don't know. I will say the steps that the federal government took to enhance unemployment assistance is going to be very helpful to a lot of our team members who are already being affected by this, and I'll come back to that in a minute. We have requested, or in the process of submitting our request to Medicare for the advanced Medicare payments. That's one of the provisions of the stimulus bill where hospitals can seek advanced payment for up to 6 months. Now that's not new money, that's basically accelerating our payments, and then once we get our payments up front, it can help stabilize cash in the near term, but the reality is, in the way the bill reads, in 120 days, all of the billing that we submit to Medicare will come back with 0 remittances, meaning it's basically a loan against our own future cash flow. So there are certain things that the federal government did which will help in the near term, particularly hospital systems that have no cash. And so I applaud Congress for the steps they took to do that. Fortunately, Ballard was not in that position. We came into this with enough cash to help us ride through the storm, but we're watching our cash deteriorate pretty rapidly. And so that's why some of those steps have to be taken by even some of the more healthy systems that you're seeing take these steps nationally. Back to the unemployment piece, you know, many of our team members, and they'll understand what I mean when I say this, hospitals generally staff based on volume. So do physician practices. If you go to any of the private physician groups in the community, they'll tell you the same thing. I mean, the busier you are, the more staff you need. The slower you are, the fewer staff you need. And hospitals are no different. And so when you see your volumes decline by as much as 70 to 80%, what happens is we flex our staffing during those time periods. Now, generally, you don't see that kind of volatility in your volume. You know, your volume may shift a few percentages each day, up or down, and you might call off some nurses, you might add hours to nurses, or technicians, or whether you're lab technicians or radiology technicians. All of those things are driven by our volume. And when the volumes took a massive dive two weeks ago, when all of the elective procedures were stopped, we did exactly what we would normally do. You flex your staffing down. So even though Ballad Health hasn't done any furlough of staff, we have an awful lot of our staff members who currently are not working or are working significantly fewer hours, and many of them are making up those hours by using paid time off. And of course, as they burn their paid time off, then they run out of resources. And so some of the steps we're looking at are designed to get them help as quickly as possible. And that's what we hopefully will be able to talk about more on Tuesday. To some of these folks, a furlough would actually be welcome news because they would be able to access those unemployment benefits that Congress was generous enough to create. That's why those benefits were put in place, is to help people who are affected by furloughs or people who've lost hours because of the lost business. And it's not just for hospitals. This is true of whether you're a restaurant, a bank, a retail store. I think we just saw recently, I think it was Macy's or one of the national retail chains furloughed over 100,000 people. This applies to any work setting at all where you've seen a massive decrease in volume. What the Congress did was significant. And I have to say this is probably venturing into areas I shouldn't, but I don't agree with those members of Congress who were articulating that the unemployment benefit was too generous. In other words, in some cases, the unemployment benefit might be more than what a person was earning in their full-time job. That may be true for our lower income employees, but don't forget, many of those employees have been using their paid time off and exhausting their paid time off. So those employees, while they may get paid more if they were to benefit from the unemployment insurance benefits that Congress provided, that doesn't mean they're netting more money generally. That means they've given up something in order to receive that benefit. So I think we'll talk more about this on Tuesday, but there's a lot of dynamics out there right now that are affecting the workforce, and this is not just true in healthcare. It's true in any industry right now that's faced massive decreases in revenue and volume. And there's different stories depending on where you are, depending on your income level, depending on the type of job you have, whether you're hourly or exempt from hourly. Everyone's story is different, and that's why this is a very complex issue to try to manage through. But hopefully on Tuesday we'll have a lot better clarity and a lot more information that I think will be helpful to our employees as well as to the public.
Scott, do you have an additional question?
One more, please. Can you tell us where you stand with the states of Tennessee and Virginia? I know with the COPA and the other agreements that you had significant administrative burdens. Can you tell us where you are in, have the states lightened up on that, given you permission to cut through some of the red tape in light of what you're having to do to address this crisis?
Yes, I want to give the Attorney General of Tennessee and the Commissioner of Health in Tennessee enormous credit, and Virginia as well. They're working on two different timetables here, but in Tennessee and Virginia, we submitted letters declaring what's called in Tennessee under the COPA, it's called a force majeure, a material adverse event. Under the terms of certification, there was a provision that was in there: in the event something unforeseen occurred that was outside the control of the health system, we can notify the states and let them know that we're going to have difficulty fulfilling some of the obligations based on the circumstances that have been imposed on us. We submitted a letter about a week ago, and I believe yesterday received a letter back from the Attorney General of Tennessee and the Commissioner of Health in Tennessee. They agreed with the force majeure declaration. They agreed that the provisions of the terms of certification trigger appropriately the force majeure and material adverse event, or the force majeure resulting in the material adverse event. And they have granted suspension of various provisions of the terms of certification during the emergency and for a reasonable recovery period thereafter. We're grateful for the flexibility. We need it right now. For instance, being able to clear the decks at Tacoma requires that we move certain services out of that hospital. If under the previously existing terms, we would have to notify the state and go through some period of notification. By virtue of suspending that requirement, we're able to move more quickly. The same thing is true in Virginia. I did receive a letter this morning from the Commissioner of Health in Virginia, specifically agreeing with what we've done at Lonesome Pine. And so I think the states are moving very quickly to give us the flexibility we need. I will say that they've not given up on active supervision. The active supervision components of the terms of certification exist, and we are continuing to have dialogue routinely with both states. And personally, I've actually spoken and had direct communication with both the Secretary of Health in Virginia and the Commissioner of Health in Tennessee. I probably communicate with them a few times a week to coordinate our efforts to respond. And I think as they've articulated in their letter to me, they understand what we're doing and they support and frankly have been very appreciative of the steps that we've taken.
Thank you, Scott. Next, we have Fevin with WJHL. Fevin, do you have any questions?
Yes, I do. Hi, Alan. I have a question in regards to the rapid testing. Now that we have more tests, will this change the criteria? And what I mean by this is that will people be able to get tested by not just showing symptoms, but by showing symptoms and not just having to be showing symptoms plus being exposed?
So right now, we're following the CDC guidelines, and with the 50 rapid test capacity that we have per day, it's really not advisable to change anything. Once we get to the capacity of being able to do 400 per day, I still would say that we would default towards following the CDC guidelines, but I think as more testing and rapid testing becomes more available nationally, we'll probably see changes in those guidelines. Our ability to do, I still believe when you look at the number of tests that we've done and the number of positives that we have, we're capturing those cases by virtue of when people are showing some symptoms and calling our Nurse Connect. So right now I would say no, I don't think that we plan to change the protocols, but I think that would be determined based on what capacity we have and what our clinical team is telling us we ought to do. And I just want to be very clear, anything we do with respect to prioritization of testing, we take 100% of that guidance from our clinical leadership who are seeking guidance from the Department of Health and the CDC.
Fevin, do you have an additional question?
Yes, one more. This is in regards to the Hawkins County doctors. Do you have any idea how they were exposed? And then I know this is also like something hard to answer, but do you anticipate do you know how many people could have been exposed by these doctors?
Let me let Jamie address that.
Hey, Fevin, can you clarify, are you talking the Hawkins County? Or are you talking about Hawkins County?
I think that's what you're saying.
Okay.
Yes, ma'am.
All right, so we assume there was most likely community exposure. So, and then we had potentially spread within our health system at Hawkins County. There's really, when we looked at the various people that may be in that facility, so from our patients to other team members to any of our contract people that may be coming in, it was just easier than trying to really formulate calling each and every individual. We chose the route in conjunction with the recommendation from the Department of Health just to do a release. That way we didn't miss anyone. We would have spent hours. So at this point, we're the people that are affected are if you were in Hawkins County from March 20th up through March 31st. At the hospital, sorry, at Hawkins County Hospital, yes.
Those are staff, not physicians.
Yeah, and to clarify, those were 4 team members. There is not a physician at Hawkins County.
Thank you, Febin. Next, we have Tim Dotson with the Bristol Herald Courier. Tim, do you have any questions?
Yeah, so thanks for taking our question. Alan, I know you said that we're looking to potentially get more information about potential furloughs on Tuesday.
You know, I don't think it's a good idea for me to speculate on that till we've had an opportunity as a team to make those decisions and then properly communicate with our team members. So I'd prefer not to speculate on that. I think right now, the one thing I will say is the most important people to have are those that are critical for the purpose of responding to the emergency, or those that are critical for responding to the other healthcare needs of the community that are not related to the emergency. And it really boils down to that. And you know, and that all of our decisions are guided by how do we provide the best service possible to our region, and who is immediately needed to do that, while we balance the need to protect their safety during the spread of this disease.
Tim, do you have an additional question?
And just one final clarifying question. Just because I think you said this earlier, but I just want to double check. There has not been any furloughs up to this point in time by Ballot Health. Is that correct?
That's correct. We've not done any furloughs. Now, I say that if you're an employee who has lost all their work hours because of the volume decline, in that case, you've got an employee who's effectively on leave without pay, other than their paid time off, and that's something we've got to help those employees deal with. And that's important to us. These are employees we are going to want to have back. We're going to need, because we're not going to be sitting here not doing elective procedures forever. But unfortunately, we don't know when it'll start back up again. So in the absence of knowing that, we want to do everything we can to give them the resources that they need so they can take care of their families. And of course, we also have the Employee Assistance Fund through our foundation, and we certainly expect that we'll make use of that for employees that have unique and serious needs that have an urgency. So I appreciate the question, and we'll have hopefully more clarity on that for you next week.
Thank you, Tim. Next, we have Richard Lovett with Cumulus. Richard, do you have any questions?
Yes, Alan, the rapid testing that's coming online, will that be available at all facilities within Ballot?
Well, the testing is available anywhere you go. If you go to any of our testing locations, if you call Nurse Connect and you are referred to a testing location, and we have, I think, 12 plus our ERs. If you have an urgent need that you need to be in an ER, plus I believe some of our urgent cares are doing it.
They're doing
So we probably have over 21 locations throughout the region, which, by the way, I have to say, there are areas of the country, pockets of the country, that even in Tennessee, that don't have any remote testing locations like that. That we have more than 21 is really a testament to the team that really, I mean, that's like starting, from scratch, 21 new businesses, if you will, throughout the region. And the execution of that's been amazing, and I give Eric and his team a lot of credit for standing those up, because it made access a lot easier. But if you access any of those locations, one of two things will happen. You'll be plugged into if you have an urgent need and you're referred to one of our emergency departments, then you'll be able to get the rapid test. If you are admitted to the hospital, you'll be able to get the rapid test. That's true for all of our hospitals. We can draw the sample and get the sample to, I believe it's at Holston Valley and at Johnson City Medical Centers, where we have the analyzers. So any of our hospitals you're at, if you have an emergent need, you have severe symptoms that require the use of an emergency room, or you're admitted to the hospital, you're going to be one of the priority folks who will receive that testing. That test will be sent to Holston Valley or Johnson City Medical Center, where the test will be run, and within hours we'll have the result back.
And our team members are a priority also.
Yeah, and our team, and you know, as Eric mentioned, and as I mentioned earlier, our team members are a priority as well as those first two categories. Thank you for that question.
Richard, did you have an additional question?
Yes, Alan, in reference to the surge that's predicted and the governor working with the Army Corps and the hospitals to bring in extra beds, will those be specifically at Greenville West and Lonesome Pine, or are you looking at all throughout the system?
Well, we've got this, the structure that we're using is an integrated structure where if you present at any of our hospitals that are not one of our 3 tertiary hospitals, if you present at any of our hospitals, if you have low acuity but need to be admitted, you likely can be cared for in that hospital by that team. If you have a higher acuity where there's a likely need for intensive care level of service or ventilator level of service that's more serious, you likely would be transferred to one of the 3 tertiary hospitals. Lonesome Pine and Greenville Community West are being used to build additional capacity for the region, where if those local community hospitals hit capacity, which it's very likely they will, then we can utilize those hospitals for that same transitionary effect. Now, one of the things we're looking at with the Corps of Engineers at Tacoma is expanding the number of, Greenville Community Hospital West, is expanding the number of negative flow rooms so that we can actually hold even more patients there that could be in isolation. But the reality is, if it's a facility that's only being used for COVID, the entire facility is an isolation facility. So the answer is, it's an integrated approach where Greenville Community West and Lonesome Pine are a part of a larger integrated system depending upon what happens in these outlying hospitals. If we hit capacity, then we'll start using Lonesome Pine and Greenville Community West, again, trying to keep the lower acuity patients away from the tertiary hospitals so that the tertiary hospitals can be used for the most high acuity patients.
Thank you, Richard. Next, we have John Engel. Sure. Next, we have John Engel with WCYB. John, do you have any questions?
Yes. Alan, if you have any clarification you can give on the Sullivan County death, do we know if that patient had comorbidities that you can share, and also were we able to trace that to travel or community spread? And I know you said you let the patient's employment family address some further details on that patient, but obviously a lot of people are going to be concerned given Sullivan County is a major employer we have there in Kingsport, so anything you can provide.
What I would say, John, without getting too much into detail about a patient's specific health issues, you know, the guidance we've seen nationally generally has been that you will see patients who are older, or patients who are older and have comorbidities, or it could be younger patients who have comorbidities. So far, we have not seen anything that would deviate from what we've been told to expect.
Do you have an additional question, John?
I do, and this is probably more for Jamie Swift. She's available to step up.
She is.
Hi, Jamie. Thank you. And this is not to put you on the spot at all. I know that Alan on Tuesday was mentioning a little bit that, you know, it's not his role to tell the governor what to do in terms of shelter-in-place orders like that. We did hear from the director of infectious diseases at Vanderbilt that he is an advocate for shelter-in-place. He thinks we do need to go in that direction. In your capacity as director of infection prevention for Ballot Health, would a shelter-in-place make your job easier, and would that be something that would make the community safer, in your opinion?
Thanks, Sean. I mean, while it's not certainly mandated from the governor, I feel like we have very strong guidelines that have been issued in Tennessee, and I feel like a lot of our general population are following those guidelines, and that's what we can ask of really those in our viewing community is to really review those guidelines from the governor and just follow those guidelines and stay safer at home.
Thank you, John. Next, we have Eugenia Estes with the Greenville Sun. Eugenia, do you have any questions?
Don't think so today.
Nope.
Thank you, though.
Okay, thank you. Have a good day. Next, we have Richard Rourke. Richard, are you still on the line with the Irwin Record?
Yes, and I'll put both my questions into one. With the spike looming, and I know that people have been making masks at home and stuff, what can the public and even like churches and organizations like that, businesses do to help the medical staff, be it a meal or childcare? What are some of the things that you anticipate?
That's a great question, and I think for one of the most important things I think a church community can do, if you know of people in your congregation who are healthcare workers, reach out to them, and particularly if they have children, and if you have a trusting relationship, I say trusting, if you have a relationship with them such that they could trust that they can leave their children with you, I think that would be very helpful. You know, that's probably the biggest concern that we hear besides personal safety of team members is if we do get a surge or when we get a surge, you know, they have to choose between somebody being there to be there for their children or coming in, and we're going to need them to come in. So as a church community, and there are many churches that are organizing around this right now, to offer this, I think it's really as simple as, you know, if churches can collect names of people in the congregation that are interested in providing support for families of healthcare workers or police officers or first responders, EMS workers, by all means, organize yourselves around offering that up, and then you know, because the time may come where they need to leave their child with someone that they trust. And I can't think of a better place to organize that than our church community. I think what people are doing to make masks, Eric said it, couldn't have said it better. A lot of people are doing work to make masks for general use. I think that's very helpful. And again, I think, you know, look, I'll go back to the previous question that John asked. It was very crafty, John, how you did that. But look, the reality is, if you need to be told at this point to isolate yourself or to do social distancing, if you have to be told or mandated to not put yourself in harm's way or put other people in potentially harm's way, then I don't know what else to say about that. It can't be more obvious what you need to do right now, and that is whether the governor actually ordered it as a mandate or is telling you here's what you should do, it's the same result. Do what the governor is telling you to do. And I think that's the question is, what can the public be doing? Right now, the best thing the public can do is help prevent us from having a surge that we can't manage. And the best way to do that is to prevent the spread of this thing. And that's it. Those are the two or three biggest things I think the public can do right now.
Thank you, Richard. Next, we have David McGee with the Bristol Herald Courier. Dave, do you have any questions?
Yeah, Megan, thank you. Alan, I have one question. You talked about capacity earlier. I know in Virginia the Corps of Engineers has cited 3 potential field hospitals. I wonder if your discussions with them, if there's been any conversation about using another facility as a potential field hospital if capacity is needed.
I did speak with the Secretary of Health. I will say Secretary Kerry was kind enough to reach out and called me directly a couple days ago. We had a great conversation. We discussed the role that the Corps of Engineers could play in Southwest Virginia. It's possible that we could do some things even at Lonesome Pine to expand its ability to serve critically ill people. Right now, I think the best thing to do is make sure we're using the existing hospital capacity to its maximum effectiveness. I do think there are other things that can be done to create additional capacity, whether it's screening or possibly even caring for people that do not have the virus, so that we can use our other hospital capacity more for the virus. But that's work that's continuing to be done. And again, based on our modeling, we think we're not going to hit our capacity until 40 to 70 days from now. So there's time here to do this and hopefully do it right by working closely with both states and the Corps of Engineers. And so we're going to continue to have those discussions with them. Good question though, David.
Thank you, Dave. Next, we have David Floyd with the Johnson City Press. David, do you have any questions?
Hey, Alan, you had announced yesterday that you're going to be foregoing your pay over the next 50 days and providing that to the Employee Assistance Fund. I was wondering if you could tell us how much of that, what the lump sum of that contribution is, and how you guys are using that fund to assist employees currently.
Well, I don't know the exact amount. It's a lot of money, and it'll be donated to. Ballad Health will be moving, instead of paying me, Ballad will be putting money into the Employee Assistance Fund at the foundation. Those funds are administered by the foundation, and I don't know exactly how it will be used. I think there's discussions ongoing now about what the possible, trying to anticipate what some of the unique needs of employees are. Look, we've used those funds. We've had employees who have lost their homes to fires, in which case we provide funds to the team member for food and clothing and housing for a period of time. Those funds have been used for a variety of things where team members have unique needs. And I have to say, the funds in that Employee Assistance Fund are by and large donated by team members through their own generosity throughout the year. Team members are enabled, they take money out of their paychecks and donate to that fund. And so I felt like, look, I know that there's team members who are struggling right now, and my personal feeling was I'm not going to ask, because of decisions I'm making, I'm not going to ask team members to endure something I'm not willing to do right by their side. And I've been, I think it's, we'll just have to wait and see where it goes from here. But and by the way, I expect that several of our members of our management team will be making similar, I won't say the same sacrifice, but similar sacrifices, even while they're working tirelessly, really nonstop, and have been for the last month. I think our management team is deeply committed to the well-being of our team members. We are all in this together for the purpose of serving our region and our community, and we can't predict what the needs are going to be, but we want to be agile enough and flexible enough to be able to meet those needs.
David, did you have an additional question?
Yeah, I think this was mentioned earlier, but could you guys repeat the total number of Ballad Health employees that have tested positive for COVID-19?
We've had a total of 8 of our own team members.
Thank you.
All right, thank you so much. That concludes our media briefing today.
Thank you.